Is Dr. Helen Wall. Good morning,
Morning
to you. You know, this is something I think lots of us in the office were like, RSV, what's that? And then a couple of people who have children said, oh yeah, my child had that. You're the same, aren't you?
Yeah, my middle child had this, and actually it's more commonly known to many parents as bronchiolitis, which is different to bronchitis that older people get, which is a chest infection. Bronchiolitis is very common in babies and children under 2, and it quite frequently leads to hospitalisation of young babies. 30,000 young children in the UK go into hospital with RSV virus, respiratory virus in the UK every year.
What is it? When it happened to your son, how old was he?
5 weeks.
5 weeks.
Yeah.
And so what were the symptoms? What were you seeing happening?
Well, he became a bit snuffly and a bit snotty, which, you know, you expect as a GP. I see lots of children with, you know, coughs and colds and snuffles. I wasn't particularly alarmed. He then went off his feed. He stopped feeding very well. He wasn't taking his milk like he should do. And then within sort of 24 hours, he very quickly started to struggle with his breathing. And that obviously caused alarm, and he ended up in hospital for about 5 days on oxygen, and that's quite, you know...
That's extreme.
Yeah, and even as a GP, I felt really sort of, oh my gosh, like I wasn't expecting this. I was totally blindsided by it. It just came out of the blue, and it really sort of affected those early days, really, with a baby. It's, you know, it's really unpleasant to have to spend 5 days in hospital. I had another little child as well at home who was only 3, and I was staying in hospital overnight. It's just a really awful thing for parents, particularly new parents, to have to go through.
Yeah, and given what you described there, the claim here that hospital admissions could be reduced by more than 80% if babies are given a single dose of a new antibody treatment. Now, the big if there is if they were given it. Now, it is a big and sometimes difficult decision for parents to make the decision to have a baby given, you know, a treatment.
Yeah, there's a
you
huge
need some
process.
Persuading, wouldn't you?
Yeah, so there's a huge process that goes on. First, the trialling of all the drugs, and then the JCVI, the Joint Committee for Vaccines and Immunisations, agree that recommend that it should be used, and the government have to accept that recommendation and put plans into process. And then, obviously, the parents have to agree to have that. And there's 2 types of immunisation that we can currently offer. And one is active immunisation. That's where we give a vaccine to somebody, like we've given many vaccines before, and that's called active because it encourages the body to then do the work to produce those antibodies that will then boost your immune system.
And in this case, that would be to a baby.
Well, in this case, this is passive immunisation. So passive immunisation is where we actually give them the antibody. So it's not a vaccine. We're not asking them to do the work to produce this immunity. We're actually giving them the product of that immunity. So it works immediately, and that's the benefit of it, because from the minute they have that, more or less, it will protect them from it, and it circulates in the bloodstream. As soon as it comes across RSV, which is the virus, it can what we call neutralise it, so grab hold of it and get rid of it. And as we've seen in the studies, you know, just over 80% of babies not going into hospital. That's just fantastic.
That's one area which there's awareness trying to be raised. An area where no awareness needs to be raised, but it's still a battle, is smoking. And there's a new campaign by the NHS. It features doctors, former smokers, ex-footballers who are encouraging people to quit. I mean, I'm assuming you've seen this. What do you think it's going to be effective?
I mean, we've done lots of things over the years, haven't we?
This is why I asked the question, because it feels as if the conversation goes on and on.
It feels like things are starting to change a bit in the smoking world, because the government are now looking at new legislation, aren't they, about, you know, banning the legal sale of tobacco to those individuals under 14 this year. So anybody born from the 1st of January 2009 and beyond would no longer be able to legally buy tobacco in this country moving forward. So I think what I see this as doing is laying open the way for us to get to that point, because we can't just go into that cold. We've got to boost the awareness of the problems that smoking causes.
Yeah, so part of the messaging around this involves former England goalkeeper David James. Let's hear what he had to say.
It's a tough thing to give up, smoking, and I'm not pretending you can just do it without a second thought. And if you get to those tough moments, think about your own health, think about the children, and think about the impact that you're having on them in a positive way by not smoking.
Yeah, and I suppose if you've got a sports star, that's a great way to get people to listen.
Absolutely. You know, young people listen to young, people who are in the media, don't they, and on social media and so on. And I think it's great that this campaign is launching. And the reason that it's being aimed at young people is because we know if young people under 20 start smoking, it's harder for them to quit. I mean, the average person takes 30 quit attempts to stop smoking. It's not an easy thing to give up, but we think that it's much easier to stop people starting smoking than it is to actually stop them smoking. So the more that we can get this message out, portray the fact that smoking is hard to stop, it should do a lot of good.
Helen, thank you very much.
Thank you. Your son's fine now, isn't he?
Yeah, he's perfectly fine, yeah.
Good.
I'm sure I'll be getting lots of cheek from him later on.
Yeah, well, were you talking about me when I was a baby on telly? Yeah, probably along those lines. So, Helen, thank you.
Thank you.
Now, we're used to seeing wind turbines made of steel, but Sweden's electricity grid is now powered in part